Good afternoon. This is Christy Kobe and Katie Knoll, diabetes educators for Population Health. And we were asked to just kind of review this with everybody today. So we're just going to go over the ACE Comprehensive Type 2 Diabetes Management Algorithm. Now, there is more to this presentation, PowerPoint, than what we're actually going to discuss today. But like I said, just a review. I know that a lot of you probably already have seen this and use this tool to help in your practice with your patients with diabetes. So thank you for just listening with us today. This tool has a lot of different algorithms related to different things. And so the first one that we want to look at is the lifestyle therapy algorithm. And if you notice in some of the other algorithms that we're going to talk about, it always starts with lifestyle therapy. And so they define lifestyle therapy that has a kind of concepts included in that is related to nutrition, physical activity, sleep, behavioral support, and smoking cessation. So every time you see lifestyle therapy as kind of that first line on the algorithm, these are all of the things that are included with that. They have included an algorithm for prediabetes. Up at the top, it kind of defines what the ACE has for prediabetes, and that kind of they go off of impaired fasting glucose or impaired glucose tolerance. And then for an A1c perspective, that's patients who have an A1c in the 5.7 to 6.4 range. Those are the people that kind of fit that pre-diabetes. Again, as you can see, the first thing on the algorithm is lifestyle therapy. And then it kind of goes from there, and it just is based on what other risk factors they might have, you know, where is their A1c, you know, that type of thing. It has on there, you know, to start medication or not. So this is kind of a good kind of flow chart to look and say, okay, where do I need to start with this patient who has prediabetes? But again, basically the thing for them is the lifestyle therapy. One of the other things that we kind of like on this list is the glycemic control algorithm. The ACE defines A1c goals as less than or equal to 6.5 for patients without any kind of, you know, other complications or risk for hypoglycemia, and that they recommend an A1c of greater than 6.5 for those patients who have maybe other chronic conditions or who are at risk for hypoglycemia, kind of like your older population. Again, the first thing on there is lifestyle therapy. And then it kind of breaks down to, based on A1c, what medication you might want to start, how many you want to start at that time. So this states that if their entry A1c is less than 7.5, you can start them on monotherapy, and it kind of ranks the medications kind of in order of the first one to use and the second one and everything like that. And it states at the bottom, which is important, that if these patients are not at goal in 3 months on monotherapy, then at that 3-month period of time, they should go ahead and be on dual therapy. So another medication should be added to help them get to goal. If their entry A1c is greater than or equal to 7.5, they say to go ahead and start dual therapy, and it kind of tells you what to do. So metformin plus another agent, and they have the GLPs as kind of that second line medication recommendation for patients. And then again, if they're on dual therapy and A1c is not at goal in that 3-month period of time, they recommend to go ahead and add another agent or to that dual therapy. And if their entry A1c is greater than 9, if they have symptoms, that they recommend starting on insulin plus another oral agent, or go ahead and start them on dual. triple therapy at that time if their A1c is greater than 9. The next algorithm that we'll just review is the one on adding or intensifying insulin. So on here, basal insulin is usually the first insulin that's started, and so it kind of breaks down based on what their A1c is, what dose of medication or weight-based dosing you would want to start with. There are a lot of patients who can self-titrate, just given a guide on how to do that, so that these patients can go ahead and self-titrate at home, so they can kind of help get to goal faster than just relying on coming into the doctor, every 3 months or every month for that. And then if they're not at goal just on the basal, then you'll want to add prandial insulin or mealtime insulin, or it says you can add a GLP. They're not on one. And then it kind of gives you ideas on how to start mealtime insulin. A good rule, one of the things that we as diabetes educators kind of look for patients who are on insulin, just to make sure that the ratios are good. Their basal insulin should, count as 50% of their total daily dose, and their prandial and mealtime insulin should count for the other 50%. So those should be fairly equal. So if one of them's off, we can kind of look and say, oh, let's, maybe we need to kind of look and see what we can do to kind of get that more in that 50-50 range. The other thing that we kind of liked about this too is it has profiles of all the different medications. It has them listed by drug class, and it talks about just kind of like what are the hypoglycemia risks, what a weight, what are the renal or the GU things that might go on, that type of thing. And so this is a nice list to kind of look over and maybe even kind of something that you could talk to patients about for some shared decision making. So this might cause a little bit of hypoglycemia, but it's not going to cause weight loss, or vice versa, or something to kind of help patients understand what medications they are taking.
Might be also a good way to talk patients into those GLP injections by showing them it's written down on here that this medication will help you lose weight too. So I think it's a persuasive tool that you could really get a lot of benefit from having printed out in exam rooms, just to kind of pull it out and say, well, here's the pros of this medication and here's the cons of this other one that you're taking if we're trying to steer in a new direction.
So this is where online you can pull up this resource. Like I said, there's quite a bit of other stuff on this resource that we didn't go over today, but like I said, we just wanted to kind of just share that this resource was out there and kind of the different things that it states, and that could be, potentially helpful when you're managing your patients with diabetes. So we will take questions if anybody has any.
Hey, this is Verda. Christy and Katie did a great job. We're going to have this information posted on the UPC CPC Plus website in its entirety, as well as links to other information. So if you have a question, please chat it in. Otherwise, you can always email them directly. And as just a reminder, we have 3 great diabetes educators who do other nutrition counseling with patients as well. Crystal Tully is joining us remotely, but Katie and Christy are here in our South Tulsa office. If you need them to help you with any of your patients, please just task them or email them. They'd be happy to set that up. And your care coordinator can help as well, and they're happy to set those times up. We have some planned time in some of our rural clinics, and then here in our South Tulsa office, we're happy to take one-on-one counseling appointments with patients at their convenience. So look forward to helping you guys with your patients as much as possible. I don't see says, do we still have laminated of these? Yes. Okay, you guys look like you're all good, but we'll send these into, we'll post them on the CPC website under the diabetes educational information. Thank you, guys. Have a great day.
Thank you.